Hi, my name's Alana, I'm 18 years old, and I'm making this video to share my acoustic neuroma story. When I was first diagnosed, I was told, do not look on the internet because you're going to freak yourself out because there's tons of lies and false information, and they just didn't want me to Google acoustic neuroma because I will not get accurate information. So instead, I went on YouTube and I searched it up and I found a bunch of people sharing their experience. And that freaked me out because a lot of those were horror stories about them having a facial paralysis and unable to walk, and it freaked me out a lot. But I mean, that's how I prepared myself for what I was about to go through. So basically, my story starts a while back. I lost some hearing in my right ear. We went to the doctor, figured it was just fluid buildup or whatever. I went a couple times. We never thought anything of it. It wasn't crazy. It wasn't bothering me that much. Eventually, a doctor referred me to an ENT who sent me to get an MRI. I waited about a month or two for that MRI. It was whatever. Nothing bothered me. So then I got the MRI, and I was called back the next day to get the results. So we were freaking out. We were thinking the worst. We weren't really sure what was going on. So when I go back to get my results to the ENT, she told us that we found a mass in the right side of my brain, well, beside my brain. She wasn't sure exactly what it was. It looked like an acoustic neuroma, which I'd never heard of before. And she said it was large. It was 3.6 centimeters, which, I mean, that doesn't mean anything to me, but after we started learning a little bit more about it, we figured out, like, that's pretty big. So that happened in the beginning of May, and we made an appointment with a specialist for the end of May. So we met with him, and he basically he confirmed that it was an acoustic neuroma, and then he went on to explain a little bit more about what it was, which like my dad had been reading up on medical journals, so he knew it all, but yeah, he explained a little more about what it was. And then he went on to discuss my treatment options. He said the first option is wait and see, but he said that mine was way too big to wait and see because it was already huge and I'm only 18. The second option was radiation, and he said that I'm kind of past that point. He said it's already big. I'm only 18. Usually that's reserved for older people who couldn't go through a surgery, or somebody who has another underlying issue that can't go through the surgery. So that's usually what that's for. So he said my only option is surgery to remove it. Then he went on to explain the risks of surgery, and with a tumor my size, I had a really good chance of facial paralysis. He said he could do as much as he could, but there's still a 30% chance that I will have like a half paralyzed face. So that was really upsetting. He said after the surgery I'll lose my hearing, which sucks, but I mean, I'm over it. And he told me that he's really good at it. He said that he's never lost a patient. He said he's done hundreds of them. He's the best in our area, which is true. He's really good. And I mean, when I left, I was kind of freaking out, but I trusted him a lot. I had a lot of trust in him. So then I went home and waited for the time for my surgery, which ended up being June 4th. June 6th. June 6th. Which is 2 weeks ago today. And so I just waited June 6th, thinking about what was going to happen. Wasn't really sure, wasn't ready to lose my face. Was kind of scared about that. So then the surgery happened. It took 10 hours. When I woke up, I felt like complete shit. I couldn't really sit up. I was really drugged up from meds. The anesthesia made me sick. I did sit up, and every time I did, I would puke, and it was really gross. So I didn't eat for a while. The very next day, Dr. Chen came to check on me. He told me I have to do all these exercises. He told me I have to move my head around, and I was like, I'm gonna puke. And he's like, you gotta get used to it because I lost my balance. That's another thing with the surgery. They cut into the balance part of your brain, so then you leave into only one side of balance. So you gotta get used to it again. As you can see, I don't have any facial paralysis. Everything works great. My cheeks work, my eyes work, everything works really good. Dr. Chen came in every single day and made sure that everything was working because I had a pretty big chance of it being paralyzed. So I got really lucky with my outcome, and I think he was pretty happy with it too because everything seems to be working. One thing is my tongue feels weird, so things taste different, but that's supposed to come right. And when I cry, it's only out of one eye, which is a little weird, but that's supposed to come right too. But I'm pretty happy that my face works. That's like the biggest thing for me. So I had a lot of visitors. I slowly got better. I couldn't do much at all for the first 2 days. I was in a lot of pain for the first 2 days. I did get up and walk the very next day, the Saturday, after my surgery on Friday. I got up and I walked a couple steps, and I mean, it was amazing to walk, that I did walk. It really sucked though, everything hurt. I was left with some pretty gnarly scars. I have one behind my ear from the actual incision. I have one on my side. That was for the fat graft. They took some fat out of my side and put it in my brain. And I have one now on my back because when I got sent home from the hospital 3 or 4 days after my surgery, which is pretty amazing because I was bouncing back pretty fast. I was home for 2 days. It was nice to sleep in my own bed. It was really great. But what happened was I started leaking a clear fluid out of my incision line behind my ear, and I had to go back. Turns out that was brain fluid that was leaking out, the cerebral spinal fluid, whatever it's called. It was leaking out of my incision, which is not good. I was prone to infection. So went back, saw Dr. Chen. He patched it up, and then that night I had to get a spinal lumbar drain or something. So they put a needle in my back, which really hurt in my spine, just to drain the extra fluid that was being produced by my brain. So it drained it out into a bag. So I had a little bag of my brain juice for a little bit. It's kind of gross. So that lasted for about 3 days. Then I had to stay another night in the hospital just to make sure once they took the bag out that nothing else happened, which didn't. That was good. So I got let home again after about another 4 day stay, 4 or 5 days. I got home. I've been home ever since. I can walk. I can see my friends. I go out. Next week I'll be driving. I'm almost back to normal. I do feel a bit dizzy when I get up really fast, or even when I'm walking for too long. I do get pretty dizzy, but that's gonna come with time. It's only been 2 weeks. Most people in 2 weeks aren't this good, but I mean, it's really not that bad at all. I haven't taken any pain meds since I've been in the hospital the first time. Headaches are tolerable; they're not that bad, and I can control them. I'm really sensitive to light and sound, but I can control if I don't look in the light or don't listen to sound. The sound is because I'm deaf in one ear, in my right ear. He was right; I lost all my hearing. But my left ear is working overtime to pick it up for it, so I don't really notice too much unless I'm in big groups of people and everybody's talking. It's kind of hard to focus on one person talking. My scar is pretty, you can't even tell which ear it was. It was this one because I keep pointing to it, but you can't really see anything. They did shave a bit, but they did a pretty good job, and I have such long hair that I can cover it up. It's not too bad. The one on my side hurts a lot. It's about 17 stitches or something. And the one on my back hurts the most because they couldn't freeze it when they stitched it up after the lumbar drain. They didn't freeze it. I'm not really sure why, but But besides that, I'm healing really quickly. I can't wait to drive again, then I'll finally be free again. I have an appointment on Monday, so 3 days from now, to take all my staples out and all my stitches out. After that, I can go swimming and then enjoy the rest of my summer, and I'm so excited. So basically, you're probably only watching this if you've been diagnosed with an acoustic neuroma. Basically, it's scary, and it's painful, and it sucks a lot, but it's nothing that you can't handle. You're gonna see the other videos here. They're gonna freak you out. People are gonna say things. It's gonna freak you out. Obviously, you have to know the risks. And it does suck. And I got lucky. But you can too. Dr. Chen was an amazing surgeon. So was his partner, Dr. P. I can't say his last name. He was great. And I'm really happy with my outcome. I got the best out of a worse situation, so something to be grateful for. Alright, thanks for watching, and good luck.